Schizophrenia is a devastating condition for individuals, families, and societies. The disorder is estimated to cost the United States over $63 billion in healthcare and other expenses. Major depressive disorder affects between 3 to 5% of adult males and 8 to 10% of adult females in the United States. During their lifetimes, 11% of 13 to 18-year-olds will experience a depressive disorder. Bipolar disorder affects between 2 and 6% of people in the United States. Like schizophrenia and major depressive disorder, bipolar disorder has both genetic and environmental contributors.
For years, we've looked at psychiatric disorders as being abnormal and being a discrete break between normal behavior and this disorder. Whether we're talking about bipolar or major depression or anxiety or schizophrenia, these all have been looked at as abnormal. And we're now, as we begin to understand more about personality and the genetics of personality, we see this as an entire continuum. It's a really marvelous interplay between what we've inherited from our parents and then how the world around us shapes our response.
A lot of people look at me and they don't think I have a mental illness. So they'll start talking bad things about mental illness. And I'll look at them and I'll let them know, hey, I'm one of those people you're talking about. And they think I'm joking. I said, well, if you look at me and you don't think I have a mental illness, then that means it's working.
A lot of the people that I do get to manage their affairs are highly intelligent people. They're people who have held jobs that have been CPAs. They've worked for major corporations, and because of the brain disorders and manic depression and paranoid schizophrenia, they are unable to maintain those jobs.
Unfortunately, there's a big stigma that goes along with mental illness. You get shunned, people don't know how to treat you. I mean, it seemed like it'd be a lot easier if I had some sort of infection as opposed to mental illness. I mean, people, I don't know, they don't, it's not treated the same way as any other disease, unfortunately.
If I can get people to understand that we all carry some of these, not only many of these genetic variants, but that we all find ourselves in different places on these personality scales, then hopefully it begins to take some of the stigma of having a psychiatric disorder off the table. And we see each other simply as lying at different points along each of these personality scales, each of which brings their strength along with their weakness.
I love the fact that HudsonAlpha is now focusing on psychiatric illness, because absolutely it is a biochemical illness of the brain, just like pancreatitis is a biochemical illness of the pancreas. And it needs the very best efforts that we can put forth in research to find better treatments. And a wonderful side effect of that, I think, will be to help destigmatize.
We are making progress, and part of it is that the experimental tools that we have available to us now, some of those developed here in HudsonAlpha, but really from the field that we work in genomics, have increased in efficiency so much, even in the last couple of years, and really in the time since we've been here, that we really have a pathway we can envision a pathway towards looking at the genetics of large numbers of individuals, their entire genomes, for instance, to see if we can find reasons why they might have a disorder versus someone who doesn't have the disorder.
When I started my practice in 1989, compared to what psychiatry is like now, is like thinking of running an office in 1989 compared to now. Think of it with no fax machine, no internet, no cell phone, no search engines, nothing. In those days, in 1989, take one disease. We had no medications for obsessive compulsive disorder. Prozac came out in 1989, and it was followed by the rest of the serotonin reuptake inhibiting drugs, all of which are wonder drugs for obsessive compulsive disorder. That's just an example of the enormous transformation that I've lived through during the years of my practice. And it's an example of why there needs to be continuing research into the production of new psychiatric drugs.
This takes a lot of people, a lot of thinking, a lot of collaboration, a lot of interactions, a lot of brain power to really try to interpret and understand these and move them forward into something that could be that can lead to a treatment.
We collaborate with neuroscientists all across the nation. Each collaboration brings something different to the table. So whereas we are looking genome-wide for changes that may associate with these disorders, our samples come from UC Davis, where we have a neuroanatomist that provides us with the samples. And then at UC Irvine, we have a psychiatrist that diagnoses the patients, which gives us samples for the best chance to identify causative changes in the genome. And then, of course, we have a group at University of Michigan that we collaborate with that can kind of follow up what we do in maybe a mice model of psychiatric disorders to find out if the changes that we actually are seeing on a genome-wide scale are actually causing the disorder.
It's really hard to define exactly what someone has, and many people who have individuals in their family are often frustrated because they don't really know what the diagnosis is. The diagnoses are difficult. This also makes it difficult to determine what the root causes are, and that's really what we want to do in this research, is to figure out why does this happen to someone, and that's really the first step towards figuring out how to do something about it, to try to prevent it or to treat it.
The brain is an incredibly complex and beautiful structure shaped by our genetics, the world around us, and a constantly changing environment. I'm hopeful and optimistic and encouraged that the new genome-wide approaches that we are now studying here at HudsonAlpha and around the world will begin to shed light on this amazing mystery. But it will take time, patience, and a lot of funding in order to really unravel those secrets.
One of the most important contributions, and this is true for really all biomedical research, is for people in families and individuals with these disorders to participate in clinical studies and research studies, because we couldn't make any progress at all without that.
This research, to me, is the best thing that's ever happened. Because I hope you all will be able to get people to understand, to get people to not to judge us because we say we have a mental illness, and to get rid of some of that negative stigma. Because mental illness don't care if you're the President of the United States. He don't care how much money you got in your pocket. It's just like cancer. And I thank God that I'm in remission now.